Health is a resource to support an individual's functions living a full life. Healthcare exists to help people maintain the most effective and optimal state of health. Therefore, the YAHAYA BELLO administration has ensured that quality healthcare be made available to the people of Kogi State. Ensuring physical, mental, and social well-being is no easy task, but paramount, and that is why this administration has mapped out plans to enable access to quality healthcare.
If I were to rate any administration in this country, and particularly in my state, Kogi State, I look at security, and then next would be health. Health holistically, not just about access to health, but access to quality health care. Because illness like death does not discriminate. It visits anyone at any time. And so when illnesses come, especially on the most vulnerable of the society, children and women, then the poor, the effect is usually devastating. And so came Alhaji Yahaya Bello as governor of Kogi State, and he's mixing the management of health, the health sector, in a way that is achieving a lot in a very short period of time. Not just renovation and rehabilitation of hospitals, because when we think health, everybody just thinks, oh, hospital, 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 normal. But what the government is doing, that is really something that is happening, is that this government is taking healthcare to the doorstep of the ordinary person.
Factors for good health, amongst others, include the physical environment, which plays a vital role and impacts health. The YAHAYA BELLO administration has seen to it that proper health structures, away from pollution of any sort, are put up and conducive enough for patients to be treated and also aiding the recovery process. Amongst these structures is the Conference Medical and Diagnostic Center, which was abandoned by the past administration. However, a mandate has been given by Governor YAHAYA BELLO for this project to be completed within 90 days, to be commissioned in January 2018, when he marks his second year in office.
We also have it in a new direction blueprint for the health sector, that the specialist hospital, Lokoja, be improved to a 500-bed ultra-modern facility. And the contractors have taken over the job. As I speak to you now, we selected 3 different health facilities: the Kogi State University Teaching Hospital, the Zonal Hospital Kene, and Kogi State Specialist Hospital Kaba as zonal referral centers for their respective senatorial districts. And what we are seeking to achieve is to improve this facility to international standard, a facility that will have independent power supply and water supply, a facility that the whole region can depend upon for when it comes to medical services. So the contractors are already in various sites, and they have been mobilized. I am sure in Okene, in Kaba, these contractors have started. But within weeks from now, we expect them to commence work in the teaching hospital, Aingba. Then the other area under increasing accessibility to our people is to establish new hospitals in local governments without secondary health facilities. We identified 3 local governments: the Adavi local government, Ijumu local government, and Ajakuta local government. And approval was given by His Excellency Alhaji Yahaya Bello that we establish new standard general hospitals. And this general hospital, when completed, will be state-of-art facility on their own, as they are going to have independent power supply, independent water supply. Then the state governments embarked on a systemic renovation of health facilities across the states. What we do is a robust cooperation and collaboration between the State Ministry of Health and Sustainable Development Goal, that's SDG. And we are able to reach an agreement. Currently, The renovation effort is ongoing. Renovation, remodeling efforts are currently ongoing in 44 primary health care centers and 8 secondary health care centers across the states.
Essentially, His Excellency has been able to bring about upgrade of facilities across the state, particularly 10 of them. That includes a specialist hospital and 9 others spread across the 3 senatorial districts. And those upgrades are currently ongoing. We also have the synergy with the Sustainable Development Goals that has brought about upgrade of facilities in Obangede, in Basa local governments and in Ibaji local governments, and even in Olamaboro local governments, in the Cottage Hospital in Ogugu. So we have upgrade facilities happening across the state, courtesy of direct funding from the state government, and also a very strong partnership with organizations like the SDG.
We have procured about 6 ambulances that have been distributed to 6 local government, and we're expecting another 6 to be again distributed to another set of 6 local government until we're able to cover the entire 21 local government. Then we'll now begin within each of the local government, which one are in their need. First and foremost, what we're doing in terms of distribution of ambulances is on the quality of local government first, before we go into the most critical situation. You can't compare Dekina, Okene, Ampa to Ogori, Ida, or Mopamuro in terms of sizes, population, and what have you. So more importantly, we are going into villages and to ensure that some of these ambulances are needed there, so that in a critical situation, our patient can easily be taken to the secondary health center to get attention. The Ministry of Health is upgrading about 10 hospitals, and they have signed an MOU with a Korean firm. So the remaining one is what SDG is taking care of. And just recently, about 2-3 weeks ago, the State Executive Council has approved the sum of 2.8 billion naira out of what a total sum of 15 billion we need to bring our health sector into a level that the entire country, be you Lagos or what have you, will be coming to Kogi State for health services.
Good education is also a factor for good health. The administration has gone further to create conducive, enhanced, well-equipped training centers for upcoming health practitioners, thus ending the reign of those who pretend to have medical skill.
We are also focusing on strengthening our health training institutions. We have 2 of these institutions, College of Health Sciences and Technology, Ida, and College of Nursing and Midwifery, Obangede. Renovation effort is ongoing. We are renovating and remodeling these facilities and expanding them. And we have also introduced newer courses. So we are already improving our health training institution, because these are institutions that train our mid-range health workers. So we cannot afford to neglect them. We need to improve on the quality of products that we get from these training institutions.
We are supposed to be training both nurses and midwives, but for now, we only train nurses, because Nursing and Midwifery Council have not approved the midwifery yet. But hopefully very soon, we're expecting the accreditation team. We're hoping that by the time they come, they will approve the midwifery course, so that we can start training midwives as well. Okay, before His Excellency Alhaji Yahaya Bello came on board, the number of classrooms we had then were only 3. Then a library, 3 laboratories, an auditorium. So when we have fresh students that are many, usually they take their lectures in the auditorium. And most of the structures were dilapidated, in the sense that some were even being blown off by wind, as about that time. So we had to rush to His Excellency, and immediately he swung into action, because the following day we visited him. He sent the Commissioner of Works to come around and do on-the-site assessment of what the environment looks like. And right from then, he set in motion people that should start restructuring the college. And as you can see, when we went round, the new admin block, because this present admin block is not acceptable to the Nursing and Midwifery Council. So it's part of what we told him, and he said another administrative block is coming up right at the other side there. that will house the boardroom, the provost's office, deputy provost's office, 5 other lecturers' offices, and then the accounts department, the registrar's office, and so on. Then the sick bay is equally under construction. The hostels we have are not adequate. When we went round, some of the hostels have been converted to classrooms since we are about starting a midwifery course. So they now decided that they are going to build an ultra-modern hostel, which is right at the back of the present administrative block, and it's going to house 180 students. But it is in 2 phases. This is the first one that is going on now. So very soon after completing that one, another phase is coming up. This is going to be a female hostel, and then a similar structure is going to be constructed for males.
Physical well-being involves pursuing a healthful lifestyle to decrease and prevent the risk of diseases rather than waiting to fall sick. Thus, the administration is dedicated to providing the required drugs and vaccines and making sure they are distributed to various health centers spread across the state.
Under the new direction blueprints for the health sector, we have set various targets for ourselves in the health sector. 1, we expect our immunization coverage to improve up to 100% by the year 2019. When we came on board in year 2016, the coverage rates, the survey that was made by MICS, what we had then was 34% coverage rates. I am happy to inform you that so far, for various vaccines, we have coverage rates that are exceeding 100% even before 2019. Let me enumerate those vaccines where we have achieved tremendous results. For example, we have up to 135% for Penta-3 vaccine and OPV. We have up to 114% for BCG, 144% for measles, 141% for yellow fever. Hepatitis B virus vaccine, we have 92%, and IPV, 137%. PCV3, we have 130%, and this is a tremendous progress when compared with what was previously attainable, the coverage rate before the inception of this administration.
Free screening for diseases that may present a risk to their healthy life has also been put in place for the people of Kogi State, who troop in their masses for checkups.
I'm here to receive treatment concerning my eyes. I just heard that YAHAYA BELLO is the one sponsoring it, our governor. The treatment is okay. They attended to us very well, and they manage us very well. I received my treatment free of charge.
I don't pay couple since when I'm here yesterday. I didn't pay shishi. So because they have been telling us that it's free. The governor said we should come and take care of our health free of charge. That is why we are here.
Free new, free Jenny. To that about Mojem to Kobo.
I was told on Friday that there's free medical treatment in general hospital, and they do operations for those that has cases on operation. So I said I should bring him here. When I came, everything was free. I struggled to get the card free. I saw the doctor free, and the operation was did this morning. They did it free.
I got the notice that medical this thing is going on here, and I rushed in. I discovered that people are being treated of various ailments and the rest. So I brought my daughter, who is being operated of appendicitis. And thank God, I am surprised the way the program is going. wherever this thing comes from, we are praying God to assist them too, because this is a marvelous assignment or program. We are surprised because we've not seen this type of assignment before.
It has been with me for the past 7 years, and ever since this thing started, even my husband left me, so I was all alone with my son. So I've been battling with this illness. Every two weeks, I lose blood. Every two weeks, I see my period, and I always go for blood. So I've been spending a lot of money, and I went to Federal Medical Center. They said I should bring 120,000, and I couldn't get the money. All the people I went to for help, they said they don't have. So I've just been going up and down with the illness like that, not until just a few days ago that somebody just, last week, somebody just walked up to me and tell me that there's a program they are running in specialists through the government that I should come. And I went, and immediately I got there, they just answered me, and they said I should come down to Okene here, that I should come for the operation. And when I came in, I came in on Friday, and they did it on Tuesday. I didn't pay a cover.
When I came in with pain, so I was asked to prepare for theater and paid, but later on the organization came around and assisted me freely. I was operate free and some drugs and drip free also.
Now this is my younger sister. She has getting this problem for past 8 years now. We are taking her from one hospital to the another, so we couldn't meet up. The first hospital in the carry and go, they asked us to bring 250,000 naira. And if they has anybody to assist us, we are looking for the money. The problem happened again, which is last month. Then we took it to the General Hospital at Obangede. They refer us to one private hospital like that. They asked us to bring 85,000 naira. So with this, even for me now, I know Igbo has anything. So I didn't have anything. So we come here say that our governor introduced a free treatment. So I could say, okay, let us just try our best. Then we take it to the hospital, which is last Sunday. Then testing her, the doctor said that they can do the operation, but I can't believe. In fact, I didn't show till they do the operation finished. Just now, I'm seeing so that my sister is feeling fine, even with the brothers and the family. We are praying for our governor. I can see even the rest of people. Some people has discharged since the day before yesterday, some yesterday, even some this morning myself.
In the case where there is an urgent need for advanced treatment, the patient is referred to other health centers for advanced surgeries and medical care.
There is the intervention fund for indigent people in our society. I have always believed that a society that looks down on the vulnerables in it is a deplorable society. It's a despicable society. And so that the government of His Excellency Alhaji Yahaya Bello, it has set up a fund for people to access. No lobbying, you don't have to know anybody, you don't have to lobby anybody, you don't have to bribe anyone. Once your case is genuine and you have proof and there is evidence that you need advanced Medicare within the state, outside the state, or even outside the country, there is a fund for that.
And I've been having an ulcer, peptic ulcer challenge for the past 13 years or so. I've been having series of treatment. Times it subsides, at times it goes, at times comes. It's affected me so much that I couldn't move from one place to the other until when His Excellency, the Executive Governor of Kogi State, YAHAYA BELLO, by the grace of Almighty God, heard of it and volunteered to take responsibility for my treatment. God will protect him, and by the time he will be finishing, he must have taken Kogi State to a greater and very high pedestal. I thank him so much, and I'm grateful on behalf of myself, my family. I am grateful to Governor YAHAYA BELLO for saving my life.
My health challenge started some years back now. So the pain started from one leg before, to the other leg. And we'll be going around from one hospital to the other. And suddenly I cannot even walk, I can't even stand. We went to so many hospitals, there is no improvement. That's how the Chief of Staff, His Excellency Edward Onoja, now forward my issue to the Governor of Kogi State, His Excellency YAHAYA BELLO, tender my issue to him. They now decide, okay, they now call Dr. Atta. Dr. Atta commented, okay, what did I want? I said, oh, I've suffered enough within the country here, so I'm begging, and in the name of God, if the government can assist me, whether if I can go, they can fly me out, and God will do His work, and either I can get full recovery from there. They now say, okay, they started the process and forward 1 million into my account for the first of all, that okay, they should use that one and process my passport and other things that need to be done.
The best way to maintain health is to preserve it through a healthful lifestyle, which provides the means to live a full life. And the YAHAYA BELLO administration has seen to it that quality medical care is put in place for the wellness of the people of Kogi State.
I really appreciate the Kogi State Governor, Alhaji YAHAYA BELLO. I really wish him good luck, and Almighty Allah should see him throughout the tenure.
His Excellency Alhaji YAHAYA BELLO, for his kindness and for the sympathized heart that he have towards the people concerning health, most especially concerning health. He's a great man.
God will reward and bless him. That's what I have to say.
I so much appreciate the Governor YAHAYA BELLO. He is the first governor, and he's going to be the best governor so far that I've seen.
His Excellency Alhaji YAHAYA BELLO is God sent to this institution. So we appreciate him, and we pray that God will continue to sustain him. God will continue to help him, bless him, and bless this administration.
As you can see, it's obvious, the State Ministry of Health now wears a new look through the renovation efforts of this new direction administration. Kudos to His Excellency, our health-friendly governor, for all these achievements.